me discuss the other important immunomodulators, that is co-stimulation inhibitors. Co-stimulation inhibitors. So if you take this co-stimulation inhibitors, remember we have certain co-stimulatory molecules. The co-stimulatory molecules, they are present on the surface of the T cells, and as well as they are also present on the antigen presenting cells, which are nothing but the macrophages. Okay, so remember we have certain the co-stimulatory molecules, right? We have certain co-stimulatory molecules. These co-stimulatory molecules, remember, they are present on the surface of T cells, as well as they are present on the antigen presenting cells, right? Antigen presenting cells. Now let me tell you the drugs, what will be their mechanism of action, let me discuss. Now this particular co-stimulatory molecules which are present on the surface of the T cells and as well as antigen presenting cells, interaction of these molecules, right? Interaction of these co-stimulatory molecules which is present on the surface of the T cells and as well as antigen presenting cells, it is necessary for the activation of T cells, right? So important point is interaction of, right, interaction of these molecules is necessary, right? It is necessary for activation of, right, for activation of the T cells. Now a point what you should remember here is we have the drugs, that is Abatacept and as well as Belatacept. These two drugs, that is Abatacept and as well as, right, as well as the Belatacept, both of these drugs, Abatacept and as well as Belatacept, remember they act by inhibiting CD80 and CD86, which are the co-stimulatory molecules present on the antigen presenting cells, right? So both of these molecules, Abatacept and as well as Belatacept, what do they do is they act by inhibiting CD80 and as well as the CD86, right? They act by inhibiting CD80 and as well as CD86. Both of them, CD80 and as well as CD86, they are the co-stimulatory molecules, right? They are the co-stimulatory molecules which are present on the antigen presenting cells, right? Which are present on the antigen presenting cells. Now you take this particular Abatacept and Belatacept. Once they inhibit this particular co-stimulatory molecules which are present on the antigen presenting cells, once these are inhibited, then there is no activation of T cells. There is no activation of T cells, and thereby the immune system does not get activated in the individual, and thereby these drugs are acting as immunosuppressive drugs. Alright. Now you take this Abatacept. Let me tell you which is the clinical condition where we use this Abatacept. Remember, Abatacept, it is used in the treatment of severe rheumatoid arthritis resistant to DMARDs. Okay, so where is your Abatacept used? This Abatacept is used in the treatment of severe rheumatoid arthritis. Usually, remember, in case of rheumatoid arthritis, we use a group of drugs which are called as disease modifying anti-rheumatic drugs. Disease modifying anti-rheumatic drugs, they are called as DMARDs. Now what are your DMARDs? These DMARDs, they include drugs like hydroxychloroquine, we have the drugs like leflunomide, we have the drugs like minocycline, we have the drugs like sulfasalazine, we have the drugs like the gold salts. These are your DMARDs, right? These are your DMARDs. If an individual symptoms are not being reduced with DMARDs. In case of severe rheumatoid arthritis, the individual may be resistant to these DMARDs. In such clinical scenario, we use the Abatacept, right? We use this Abatacept. Next to this Abatacept, you take this Belatacept, right? You take this Belatacept. Remember, this Belatacept is used for preventing the rejection of the kidney transplant, right? Used in the treatment of prevention of, right? Used in the treatment of prevention of the kidney transplant. So this is about the co-stimulatory inhibitors. So let me shortly revise here. Remember, we have certain co-stimulatory molecules. They are present on the surface of the T cells and as well as the antigen presenting cells. The interaction of these molecules is necessary for the activation of T cells. Now the drugs what we have is Abatacept and as well as Belatacept. Abatacept and as well as Belatacept, they act by inhibiting CD80 and as well as CD86, which are the co-stimulatory molecules which are present on the antigen presenting cells. Now once these co-stimulatory molecules are inhibited by Abatacept and Belatacept, there is no activation of your T cells. Abatacept is used for the treatment of severe rheumatoid arthritis resistant to disease modifying anti-rheumatic drugs. And you take the Belatacept. Belatacept is used for preventing rejection of the kidney transplant. So this is about the co-stimulatory inhibitors. Let me discuss the other immunomodulatory drugs, that is interleukin 1 inhibitors, right? Interleukin 1 inhibitors. Now if you see these interleukin 1 inhibitors, the drugs what we have is Anakinra, right? The drugs what we have is Anakinra. Now if you take Anakinra, remember Anakinra, it is an inhibitor of the interleukin 1, right? It is an inhibitor of the interleukin 1. Now where is this Anakinra being used is, it is being investigated for use in case of, right, in case of the septic shock and as well as rheumatoid arthritis. In this clinical scenarios, we use this Anakinra. Now apart from this interleukin 1 inhibitors, we have certain other drugs as well. Now if you see the other drugs, it includes Nintedanib, right? The other drugs what we have is Nintedanib. Now if you take this particular drug, that is Nintedanib, it is a small molecule kinase inhibitor. Now this particular small molecule kinase inhibitor, what it will do is, it blocks multiple pathways involved in the scarring of the lung tissue, right? It's a small molecule kinase inhibitor that blocks, right, that blocks multiple pathways involved in scarring of lung tissue, right, involved in scarring of the lung tissue. Now because this Nintedanib, it blocks the multiple pathways which are involved in the scarring of the lung tissue. Now where is this used? Remember, this particular drug is used in case of idiopathic pulmonary fibrosis, right? Used in case of idiopathic pulmonary fibrosis. Now if you take the route of administration of this drug, the route of administration is the oral route of administration. Next, apart from this particular drug, that is Nintedanib, we have another important drug which is called as Apremilast, right? Apremilast. Now if you see this drug Apremilast, remember it is a phosphodiesterase 4 inhibitor and it is indicated for severe plaque psoriasis and as well as psoriatic arthritis, right? So this is a phosphodiesterase enzyme 4 inhibitor, right? It is a phosphodiesterase 4 enzyme inhibitor. Now where is this indicated? So this Apremilast, it is indicated for severe plaque psoriasis, right? Severe plaque psoriasis, and not only that, this is also indicated in case of, right, also indicated in case of psoriatic arthritis. So this is about your Apremilast. Next, so if you take these other drugs, like we have two important drugs, that is Nintedanib and as well as Apremilast. Nintedanib, it's a small molecule kinase inhibitors that blocks the multiple pathways involved in the scarring of the lung tissue. And because of this property, it is used in treatment of idiopathic pulmonary fibrosis, and it is approved for the oral treatment. And we have the drugs called Apremilast. It is a phosphodiesterase 4 inhibitor indicated for severe plaque psoriasis and as well as psoriatic arthritis. So these are your immunomodulatory drugs which are acting as the immunosuppressive drugs.